Good afternoon, everyone. My name is Nancy Stamper. I'm the chair of the Compliance and Ethics Committee of the North Broward Hospital District. I'd like to say for the record that this meeting has been duly noticed. Today is Wednesday, January 21st, 2026. I am calling this meeting to order at 3:05 p.m. Ms. Lopez, would you please confirm that?
Yes. Commissioner Tanner, absent for the record. Commissioner Hage.
Here.
Commissioner Pernacano.
Here.
Commissioner Ainger.
Here.
Commissioner Berry, absent for the record. Vice Chair Nicole.
Here.
Chair Stamper.
Here. Item 4, public comments. If there is anyone who wishes to address the committee with public comments, please come to the podium and identify yourself for the record. Each person will have 3 minutes to speak. This will be the only opportunity for public comments during this meeting. Item 5, approval of the Compliance and Ethics Committee meeting minutes dated October 29th, 2025. I understand the minutes have already been reviewed by our Board Secretary, Commissioner Hage. Without objection, the minutes are approved unanimously. Topic of discussion, items 6.1 through 6.4, presenter Christopher Martin.
Thank you, Commissioner Stamper, Chair Stamper, and good afternoon to all of the commissioners. When I first started presenting in this meeting, I said it was a good day to be part of Broward Health, and yet today, a year after or so that I've been presenting, it's still a good day to be a part of Broward Health. Every day I'm very happy with the collaboration that every single leader and every single manager, supervisor, all the employees provide to us every day. Anytime there's an issue, anytime we have a concern, they are always there, being supportive and collaborative. And even just bringing in recently, Mr. Cobb as internal audit has made overtures to us and is including us with audits, and it's just really nice to be supported in both regard in the organization, so we appreciate that. As we go through our agenda, we're going to start with a work plan update. We are currently we have 31 items approved by the board. 16 of them are in progress, 9 are completed. If I were to report that report today, we'd have about 5 more of those completed. We met in December as a leadership team in our department and determined that we would have most of those completed by March. And so we are now progressing toward developing our work plan for next year as we start our risk assessment. We don't foresee any of these not being completed by the end of the year. So we anticipate full completion, well above our goal of 80%. We do anticipate 100% of completion on this. Our staffing update, if I could have Noreen come up here for a second. Noreen Hamilton has joined our team, was previously part of our team, has been promoted to the Regional Compliance Officer of Broward Health Coral Springs. Noreen, you've worked for Broward Health how many years now?
21 years.
21 years. 21 years. And had worked in revenue integrity for how many years? Or billing and revenue management?
Over 18 years.
Over 18 years. So such a wealth of experience. So we're very fortunate that she's worked in our department at all. And then for her to have the opportunity to promote her at Coral Springs. So just wanted to give you the opportunity to say hello to her today. As we continue working through the expectations from the government through the General Compliance Program guidance, as well as the DOJ guidance on effective compliance programs, we are marching toward completion of our 3 months. Our 3 months is extended a little bit longer, but the reason for that is because we are finalizing our effectiveness survey, which we will be launching in the month of February, working with Jen Smith and her marketing team on the best way for that to be done. So that way we can ensure that we are getting a temperature check on how well we are doing as a compliance department, and that will then feed into our risk assessment and then help develop our work plan for the coming year as to whether or not we need to step up or improve our communication. Our 1-year program, as far as the items that we have on that list are on target. We feel comfortable with that. And then 2 years, the 2 years one is a lofty goal because some of those are things that we still haven't decided how we're going to factor in. But we are moving the program forward, and we hope to be able to be ready by fiscal year 28 for an audit of our program at that time. I'm hoping that that time we'll be ready to have an outside organization or even internal audit to be able to handle that for us. That's our goal. And Compliance Week recap. Compliance, it's a team sport, was a great success for us. We were handed out 1,500 pins, and let me just go ahead and hand out some more pins and mouse mouse pads as well. Because compliance is a team sport, and I need all the commissioners part of that team sport.
Come Halloween, we need lots of these to give to the kids in the neighborhood.
And so we were able to hand out these, which are really great because we put them on all of the units, so all of the unit secretaries, so it's very local, very centralized, so they can easily see them. We were able to hand those out in our billing department, our accounting department, our legal department, so forth and so on. So everyone is able to see very clearly. And the pins we're handing out left and right to the nurses because the nurses love pins more than anything else, it seems like. And so it was really good, and we handed out some hand sanitizers. We literally went floor by floor in every hospital for day and night shift, carrying around carts of water and snacks. And those snacks were graciously provided by the CEOs of each of the hospitals and facilities. And so they were contributing as part of this. So we were able to give out some praise for that as well to them, so that they can see locally that the CEOs, the executive teams are each committed to compliance. And then we also went around doing compliance grants. I don't know, is this a PDF or is the video available? The video? Oh, okay, here we go. It's a really short video because I don't want to take a lot of time. But what we did is we created this poster and we had people take pictures in that. And our privacy officer, Gabby, was the photographer, so we ensured that patient privacy was always secure. And then we also got approvals for that for each person so that marketing is happy as well. And that's it. It's really short. We have, I think, maybe close to 500 pictures. Yeah, so we're working on an art project next to do something with that. But I didn't include this in the presentation. What I need to tell you guys is that we also had a Family Feud event, right? In which we had the executive teams of Medical Center against the executive team of Rehab. The Medical Center will tell you that they proudly won that competition. So we set it up, and they even have a trophy. And then Coral Springs and Broward Health North were against each other, and Matt's very, very proud of his trophy. We even have a picture of Kristen trying to steal the trophy from him. He displays it proudly in his office now. So it's just another one of those things where we're trying to create buy-in, awareness, and creating this culture that compliance is the right thing to do, and not something that we're just looking over your shoulder trying to catch you doing the wrong thing. And so that brings me to the very end of my presentation. Ethic behavior is doing the right thing, but no one else is watching. Thank you, Judy, for that. Do you guys have any questions for me today?
I just want to say, Chris, the life and the commitment that you bring to your job and to compliance, we very much appreciate. Yes.
Oh, thank you very much. It's a joy. It's a joy also to work with this great team that I work with every day. I regularly call them my bosses, because they regularly tell me what I need to do. So all of our success really is because of them. I promise you that. Exactly. Thank you very much, Commissioner.
Hearing no further business, without objection, this meeting is adjourned at 3:13 p.m.